Hi, May is Skin Cancer Awareness Month, and over the last few days we talked about melanoma and also basal cell cancer. We divide skin cancers into two types, the melanoma types and the non-melanoma. And the non-melanoma consist of the basal cell ones and the squamous cell ones. Squamous cell cancers originate in the very topmost layer of the skin called the epidermis, and in some areas like the upper eyelid it's only 1/20th of a millimetre, it's incredibly thin, and in other areas like the palms and the soles of the feet it's up to 1.5 millimetres, so really that very superficial layer. Why does it happen? That's because of a DNA mutation in the skin cells, and that occurs over years of sun exposure, and it's commoner in people with fair skin, fair hair and fair eyes. It's commoner in people with outdoor occupations. It's commoner in people on immunosuppressant drugs. Like any type of cancer, the earlier you can diagnose it, the better. And squamous cell cancer very rarely spreads to other areas of the body. And the prognosis or outlook is extremely optimistic. If you find it early, you diagnose it and then you get rid of it. How do you diagnose it? Well, if you have any skin spots or scabs or bumps or any little growths or any little ulcers or any breaks in the surface of the skin that don't heal, go and see your medical doctor and get a diagnosis. Sometimes that will involve a visit to a dermatologist or a biopsy where a tiny sample is taken under local anaesthetic. And the treatment generally is to remove it by excision or cutting out under local anaesthetic. You can freeze it if you've got the diagnosis correct, because by freezing you destroy the cells, and you can also use some topical or chemotherapy medicines in a cream form. The outlook is really good if you diagnose it early. The incidence is rising on the long term, and your key is going to be prevention. How do you prevent it? You can guess. The answer is going to be wear a broad spectrum SPF factor at least 30 to target UVA and UVB rays. Seek shade in hot times of the day. Wear a sun hat, wear sunglasses. Don't get sunburnt and don't use sunbeds. And they look a bit different sometimes, so they're a bit tricky to diagnose. So they can sometimes look like an ulcer, they can sometimes look a bit scabby, they can sometimes look a little bit like a scar. As always, if you see something you're not sure about, do get it seen to. Take care, bye.